My name is Dr. John Klimkiewicz. I'm at Washington Orthopaedics and Sports Medicine. I'm a fellowship-trained orthopedic surgeon with emphasis on sports medicine with a subspecialty interest in biologic knee preservation. As knee replacement has become very successful, the indications to do this have, let's say, expanded. And with that, there are some limitations in terms of how old or how young the actual patient is as it relates to replacement. Biologic knee preservation looks to tackle that question and problem by biologically, let's say, resurfacing the knee. And when you look at that, that can mean different things depending on what the patient's problem is. In the younger athlete, it may be a result of a ligament injury, in which case you're looking to reconstruct or repair the ligaments that have been injured to the knee. In the younger or older athlete, it can also involve difficulties, let's say, with the articular cartilage and the meniscus, both of which are important to the long-term health of the knee. Biologic knee preservation looks to either repair or replace that, or looks to provide an environment with some of the biologics that have become, let's say, available to nourish growth and maintain a healthy joint. When we look at some of the non-operative approaches toward biologic knee preservation or replacement, these can include both a mechanical aspect and a biologic aspect. Oftentimes, the mechanics of one joint looks to place stress and concentrate stress on one area of the joint. There are, let's say, newer forms of bracing that are available that allow us to, let's say, unload that area of the joint. And for the, let's say, active athlete or patient who's looking to avoid some type of a replacement, either because of, let's say, medical comorbidities or too young for a replacement, these can often offer a nice bridge until replacement, and at times are even prognostic for, let's say, more invasive procedures that look to, let's say, reestablish the equilibrium of the joint. There are some new techniques that have been, let's say, introduced to the scientific community over the course of the last 5 to 10 years. These include hyaluronic acid and some of the viscous supplements, where we're looking to provide a more normal joint, let's say, equilibrium and restore some viscosity to the joint fluid that is present within the joint. And some of the newer techniques involve even stem cells and what we call plasma-rich platelets, where we're injecting cells from one's body, from the blood, and what we do is we take one's blood, we spin that down, and obtain a lot of the growth factors and some stem cells that actually look to promote a more healthy joint. And these techniques have often served as a very nice bridge for patients who are looking, let's say, for a more active lifestyle and yet trying to avoid surgery.